Hi, my name is Richie, and I am originally from Massachusetts, here visiting in Florida. I worked 34 years at Toyota Motor Sales, the distributorship in Massachusetts, in Mansfield, and I retired last year, and I'll be snowbirding down here. I guess I started losing my hair back in my late 20s. It started receding back, but I always had kind of full hair inside here until the past probably 20 years. It's been a progression, slowly losing it, and that's why I'm here today. Hair loss, my dad receded pretty much, and I think in his bloodline there was a few bald guys actually, and my brother has also lost a lot of hair. I have had one prior procedure in 2012. Actually, the first result I had, I was overall pretty happy with it, especially a few months down the line when you start seeing the progress and the growth. And so yeah, overall I was pretty happy. Today, well, I have been off a Propecia for a couple of months while I was visiting here, and I'm kind of freaking out that more hair is thinning out, so I'm hoping to fill in what I just suddenly kind of lost the past few months. Probably not from the preventive medicine I should have stayed on. I don't know, but I'm hoping to fill it in. Yeah, my hair loss affects me, I think in a negative way that, it affects my confidence basically, and it just makes me feel good to have more hair and just something to style in the morning and look the best I can. I think so far I'm really impressed by with the initial visit and meeting the doctor, and I feel confident about it. That'll be a better experience, and I've already recommended actually somebody stopping by for a visit, so I feel comfortable.
I'm here with my patient Richie, and what we've done is basically redesigned his hairline. So I want to show you what his hairline looked like from his prior procedure. So what they've done is they've done some good work actually. They haven't done anything real bad. His scar in the back is real nice. It gives us plenty of room to do what we need to do today. But in my opinion, what they did is the hairline for him doesn't really lend it to being very youthful. I think we could get a much more youthful look by dropping the hairline down and then squaring off these recessions. So you can see where we've drawn the line. It's going to give him a profile like this. And what that does is it squares off his profile. So now he has this nice angle here. So this is the new hairline. This is where he was before. So you can see how much real estate is up here, and that just doesn't lend it to being as youthful as it could be. So we're going to drop it down, square it off. That looks, that right there drops a couple years off his appearance, just having that squared off hairline. So that's what we're going to do today. And what we've elected to do is start from the front with those 1 and 2 hair micro grafts, and then transition those into the stronger grafts behind that, which will give him the density that he needs. We're going to start from the front and work our way back. All the way back, we'll probably get into about 2/3 of the way and set up a natural look appearing crown. Now if we have the hair to do it, I'll hit his whole head, but it just depends on his elasticity and his donor. So we always have realistic expectations going in. We always have a game plan. We want to make sure we have our priorities right and give the patient what he wants. So Richie, I'm looking forward to seeing your results. We'll be checking in with you. Dr. Huebner here at Natural Transplants. Just wanted to check in here with Richie. We're about, I don't know, maybe 1/3 of the way through the procedure. At this point, the strip's been taken out. We got an extra strip for him, so I'm very excited to see what that's going to give him. And he's all sewed up, and we've had about, 5 to 10 bags of potato chips and Chips Ahoy, candy.
No milk.
No milk. We're going to get some milk maybe for the milk and cookies. He's got his shoes off. We're watching a movie. How's the day been for you? I should ask you, Richie, how's your day been so far?
My day has been very relaxing and welcoming and easy so far. I'm pretty impressed.
Good.
And I'd be happier with the milk, but that's okay.
We do take suggestions very seriously, so we're gonna do some milk for next time. I'm gonna bring you around here and show the incision so you can see exactly how it looks. But the day couldn't be going any better today. Okay, so I wanted to show you Richie's suture line. It's been all sewn up, even being 3 strips out, so we got almost a 1.5 centimeter wide strip, about 30 centimeters long, so you can see how much tissue and how much hair that's going to yield him. But I wanted to show you what a suture line looks like. Everyone's always worried about suture lines with the strip technique, so here it is. First of all, you can see that his hair, existing hair, even though it's a little wet, you can just barely make out the suture line. When that dries, you're not going to be able to see that at all, so it's completely hidden. Look how we're in that safe zone, so we're getting the best hair. This is actually going to recede this way, and this is going to recede this way, so we want to stay in that safe zone. So we're well within that safe zone, and that's his best hair. Alright, so you can see what it looks like. What you can see is that the 2 edges of skin are completely together, and it's as if you took a little white pencil and drew a line, a tiny line around. That's what this is going to look like, and it's going to be so faded you may not even be able to find that once this is healed. So this is right away. You can see exactly how it looks. The tension is exactly what it needs to be to have a perfect suture line. We went all the way around, even in front of his ear, so that's how we get those long strips all the way around. You can see it goes all the way around. So with that's how it should look. It should look right together with very little tension. And this is a guy that's had a prior procedure and still was able to get it together and yield him a lot of hair. He could even have another procedure in the future if he wanted. The minimum time you would want to wait would be 9 months. That gives the skin enough time to stretch out again, to adapt, to let your body adjust. It makes no sense to go in any sooner. Number one, it takes 3 to 4 months for the new hair to grow in. And then it takes another couple months for it to thicken up and get some length on it. So why would you go back in unless you know what you have already? Once you already know what you have, then you can go by and fill in the gaps if needed, or figure out what you want to do. So, but you can see exactly how it looks. If you needed another procedure, you could go either right above or right below, and you'd have another untouched strip. If he had FUE, you would basically see polka dots all the way through his entire donor area. So if you had to do a strip, you wouldn't yield quite as much hair. He has untouched, fresh hair you could tap into if he needs to. This is why in his case, the FUE would be a horrible, horrible, horrible choice for him. So can't wait to see his results. Dr. Huebner here, Natural Transplants. I just wanted to check in again. We're here at Richie's surgery. So at this point, we've already started sewing him up and we've harvested the strip. But I wanted to show the strip to our viewers. A lot of people are asking what the strip looks like. So I want to show you. So what we have here is we have basically a strip that's 1 centimeter wide, and in Richie's case we got about 30 centimeters length of tissue. In addition to that, we were able to get an additional strip because of his nice elasticity. We were able to get him even more hair. So I'm going to zoom in here and show you exactly what the strip looks like now. So I want to show the strip what it looks like here. So you can see in this case, this is a 30, maybe 29 centimeter long strip, this one. This one's about 30. But I wanted to show you what it looks like. So this is the top, this is his top of the skin, and this is below the skin. So you have a layer of epidermis right here, and then you have underneath there, this yellow part is subcutaneous fat. So all of us have subcutaneous fat, which helps us with, keeping heat and serving heat, and gives us a little cushioning. So it's just not scalp right under the skin. So it's very superficial. We go nowhere near the scalp. But what you can see is in each one of these hairs here, you can see a little bulb, like a little ball. And that's the follicle. And then they're going to see the hair that goes straight up. Here's a follicle and the hair that goes right up out through the skin. So it's really important when you're taking these strips out that you're not cutting through these follicles or cutting through this hair. Otherwise, you're not going to have any growth. And you can see we came well below this follicle. So you can see the follicles all lined up right here. All lined up. So we got just below that. You actually want to keep a little bit of this subcutaneous fat with the follicle. Now obviously this is going to be cut into slices, and this is going to be cut up into individual grafts. But I wanted to show you there's zero transection in this whole strip. You have all the follicles maintained in this perfect plane. Nothing's been transected, and these are going to produce amazing grafts. These are really quality follicles right here. Same thing, this strip, same thing. You can see the follicle edge right through there. Zero transection through the entire follicle. And these are the extra bonus strips. So this is the extra hair we were able to take just because of the elasticity he had. I got him another 21 centimeters of additional hair, and that's just bonus. That's just because he's a nice guy. So we always try to maximize this the patient's hair. Why go through this more times than you have to? So this is what it looks like. We always keep them in saline, so I'm going to take these grafts here. We handle them with a lot of care, and we put them right into the saline here. And our technicians are going to come and cut up these grafts. Again, it's so important, the people that are cutting your grafts. It's so important. So we're about 2/3 of the way now through the surgery. So the strip has been removed at this point. He's all sewn up perfectly in the back. We've also done the sights on the front, which we'll show you in a little bit. And I wanted to ask Richie how his experience has been. We're now on bag 32 of chips, and he's got a little munchies from the Valiant that we gave him to help him relax. He took a little nap earlier, but I'll let you hear from him. How are you feeling, Richie?
I'm feeling fantastic. You know, the atmosphere is really wonderful, and I feel relaxed, and I couldn't say anything, I couldn't speak more highly about the procedure.
Thanks for saying that. We, you know, had a couple little breaks, walked around, used the restroom, using his cell phone. It's really easy surgery. Again, I call it a surgery, but it really is just a procedure to go through. He's been watching TV, and so I want to bring you here and show you the sights. You can see exactly what we got. The grafts are still being cut up at this point by our technicians, but pretty soon the only step left is basically for them to take those little grafts and place them into the slits that we designed here. And again, the slit determines the angle that the hair will grow. It's very important that the angle of the hair is not sticking straight up like a lot of people would think. It actually angles forward, and then the hair will be styled back over. So, but I want to bring you in here and show you what we've done here. So Richie, we've designed redesigned a new hairline in him where we've squared it off. His original hairline came into about like here. He had this island of hair here in the middle. We've dropped it down in the front about 2 centimeters, and we squared it off to give him a more youthful appearance. And you can see where his hairline is going to be. It's this little line right here, staggered. These are all 1 and 2 hair grafts, singles and doubles. And then that's transitioned into these larger grafts behind there. So these grafts are going to have 4, 5, 6 hairs. These are the hairs that are going to give you density. And these are not going to be looking pluggy because you're going to have this transition zone with 1 and 2 hair grafts in front of it. But at the same time, putting 1 and 2 hair grafts in the central portion of his head is going to yield him very limited density. But you can see how we've come back here. What we've done is basically set up a natural crown. So we didn't have enough grafts, even with his elasticity, to get all the way back. So we set up a natural crown, so it looks like you just have a natural crown opening up in the back. If he decides to grow his hair a little longer, give it some length, you can style it back and even get some coverage in that crown as needed. But we basically, our strategy today was to start from the front and work our way back as far as we could go. So this is going to be a huge difference for him. He's going to gain about 30 to 40% density in the areas that he already has, and can't wait to see his results.